Hey everyone, CPAP Gentleman here, and today we're going to discuss some of the common myths and misconceptions about sleep apnea and its therapy. Hey dude, I heard sleep apnea is a scam. A big fat scam. I know, right? It's all a big conspiracy. Greedy doctors trying to line their own pockets. It's like this big industry, man. I bet you anything, mate. It's the Illuminati. There seems to be a lot of common fallacies about sleep apnea syndrome, and a lot of it unfortunately stems from the lack of education surrounding the condition. The student's not often at fault, it's usually the teacher. So I thought we'd cover some popular yet misguided beliefs and teach you why it isn't so. Thanks, Jimmy. Sleep apnea is a scam. People never used these machines decades ago. This is sort of like saying, I don't see why I need to get my teeth cleaned twice a year. It's not like my ancestors had dentists. Or, vaccines are dangerous. Come on, polio vaccine? Polio's a lie. CPAP therapy continues to gain momentum in the healthcare industry because many doctors, including family physicians, are starting to realize that sleep apnea is a root cause of a lot of secondary problems. Problems like high blood pressure, for example. Many doctors would prescribe antihypertensive medications without realizing that the hypertension was a direct result of a sleep disorder. Our knowledge of the human body is constantly expanding, and as new things come to light, so do new therapies. I don't feel tired during the day. I don't need to use CPAP therapy. Many patients that are referred to a sleep specialist by their family physician may have never experienced symptoms of drowsiness or fatigue during the day. Maybe they just had an issue with snoring, or perhaps there were concerns about heart health. Not everyone with sleep apnea will feel tired after a night of sleep, but the dangers of leaving the condition untreated are still the same. You still stop breathing, which puts a tremendous amount of strain on your heart and other organs. The difference lies in how the body responds to an apnea. Your body can either recruit extra inspiratory muscles in an effort to try to overcome the obstruction that has happened, which in turn expends a lot of energy, and you end up like this guy. Or the body responds by doing nothing, in which case your oxygen levels will still fall, and eventually you'll wake up because your brain realizes there's something seriously wrong here. I'm just going on vacation for a couple of weeks. Not using my CPAP won't be a big deal. Sleep apnea doesn't go away just because you're hitting the Bahamas. It causes your body turmoil every time you go to sleep. Consider it like this. If you were prescribed glasses by your optometrist, you wouldn't think, hey, I'm just gonna drive down to the convenience store blind. It'll be quick, don't worry. At the end of the day, you can probably get away with not using the therapy once in a blue moon. After all, this is a type of sleep disorder that has a cumulative effect on you over time, if left untreated. Just don't make it a habit. My mask is still functional and in one piece. I don't need to change it. Ew. Come on, really? You wouldn't use your toothbrush for 2 years just because the bristles are still intact. Changing your mask regularly will reduce the likelihood of you getting sick and also ensure your therapy remains comfortable and effective. I still have plenty of water left in my humidifier. I'll change it in a few days. It's really easy to get lazy and not change your humidifier water daily. But guess what? Bacteria loves to grow in warm, moist, dark places. It's real cozy. So unless you want them to start growing in you, make sure you're diligent in replacing that water. Trust me, it's a good idea. I should be able to change my own CPAP pressure. My comfort is top priority. Ever walk into a pharmacy, go up to the counter, and tell the pharmacist, hey, let me in. I want to play around with this drug dosage. On second thought, if you have, I don't want to know. Your sleep specialist will generally prescribe you an optimal CPAP pressure based on the results of your sleep study. This optimal pressure is usually the lowest amount of force needed to keep the airway open at night. Any lower and your airway will continue to obstruct, which in turn will leave your condition untreated. Any higher and you may start to have central sleep apneas, which may cause frequent arousals and fragment your sleep. You could also start suffering from stomach bloating, as the excess air will likely travel down your esophagus. If you have any questions about sleep apnea or CPAP therapy, feel free to leave a comment down below. I don't always answer comments, but when I do, you'll be happy I did. Thanks to all of you for watching. Like, subscribe, share. I accept free hugs and kisses as well. Because at the end of the day, sleep apnea is all about the heart. CPAP gentlemen, out.